of internal detoxification. We try to remove ama and we try to improve the functioning of the reproductive system. Then vata, as you mentioned, is very important. It governs the major functions of the reproductive system. So we have to bring control under vata, and with certain purificatory procedures. Now in Fertility Dost, although it's an online platform, but I can proudly say through our consultations, there are few therapies that the patients are taught to do at home, which have a tremendous impact on their fertility function. So those also could be done. So it's a holistic approach of diet, of nutrition, lifestyle changes, medications, oral medications, and the external therapies which we suggest to the patients according to the state and stage of the menstrual cycle, both for the male and the female partners, which have been proving to be extremely useful for them in improving their reproductive functions. Let me give you a brief of what is the concept of nutrition according to Ayurveda, what exactly it is and how different is it. You may find a lot of information on the internet about supplements to improve fertility health, about supplements to improve ovarian function, to improve the ova quality, to increase sperm count, to increase the sperm quality. But it has again to be customized from patient to patient. I will tell you now some general guidelines of Ayurvedic nutrition protocol to be followed for any patient of infertility. First of all, they have to follow their hunger quotient. We have to work on their appetite, their hunger quotient, and their digestion. Secondly, food that they eat has to be local and seasonal. Thirdly, the food that they eat has to be procured fresh. It should not be refrigerated, stale, canned, processed food. It has to be freshly procured, freshly cooked, and freshly eaten, warm. It should not be chemically manufactured with a lot of additives, lot of masalas, genetically changed food, hybrid food, or hormonally induced, like chicken you see these days, or meat is hormonally induced with some chemicals. Then general foods that should be eaten are, Ayurveda strongly believes that these are the Vajikaran foods. As doctor mentioned, Vajikaran is the foods that improve the quality of Shukra, that is the ovum and the sperm. So dairy products are known to be very good in promoting fertility. Seeds, nuts, fruits, and fresh vegetables, whole grains. There are certain spices. Now again, there is indications and contraindications according to patients. For example, if a case of PCOS comes to you with a lot of hormonal imbalance and a lot of inflammation, you see in their reports, their ESR is on the higher side, their CRP is on the higher side, their WPC count is not normal. In that case, we have to tell them to avoid dairy products. We have to tell them to avoid non-vegetarian food items, specifically fried ones. It is not like Ayurveda is completely against certain foods and we have to ban them. Ayurveda is a holistic science. So according to the patient, if it is mandated that we tell them to avoid certain food groups or food items, it is because of that specific history that we see in them, or the specific reports that we see in them. So in certain patients, we have to tell them that you can't have curd, you can't have milk, you can't be having paneer, you can't be having dairy products like ice cream, cold, like smoothies. Smoothies cannot be validated in certain patients. They say that this is one fertility smoothie, which is very good. It is so many things are mentioned. It is antioxidant, vitamin C, iron, this thing, that thing. But is your body able to digest it or not? Is the question. If the digestive system is not in the stage of digesting that, then what is the point? Even though that food may be extremely nutritious, extremely loaded with vitamins and minerals, but if your body is not able to assimilate, then there is no point in having it. On the contrary, it will increase the inflammation. Then there are certain spices like cumin is there, garam is there, then turmeric, ginger, garlic. This we have to use and incorporate accordingly. Again, I'll give you an example. If a patient is of Pitta Prakruti, and for them we are going to plan the diet, then we cannot be giving a lot of spices, because originally their constitution is such that they have a lot of body heat. So if we give them foods which are again heaty or spicy in nature, then they may produce more of heat related issues. In general, sweet and a little bit of sour foods are good in promoting fertility health, whereas salty, spicy foods should not be eaten in excessive amounts. Fried food should not be eaten in excessive amounts. Very heavy foods should not be eaten. Milk, ghee which is procured through the actual process of ghee making and not synthetically made like how it is commercially made today. Ayurveda mentions a specific method of making ghee, that is the Bilona method, which is ideal. If you are able to get that ghee, it is the best. If you're not, so you should always try for best options for you. We cannot say that you have to go to this particular area and get only that ghee, then only it is possible. I know practically there are a lot of limitations. So what is the best option for you? You can go for sesame seeds, dates, pumpkin seeds, honey, avocados, beans, pumpkin whole, moong, turmeric, amla, broccoli, fenugreek, pomegranate. There are a lot of, it's a big list of fertility promoting foods that have been mentioned in Ayurveda, which are known as Vrusha and Rasayan, Shukrala food items. But there cannot be a generalized description, because at every case is different, their presentation is different, so we have to handle the case accordingly. Sometimes it is primary infertility that the patient has, sometimes there is secondary infertility with associated issues. Those could be hormonal, those could be metabolical, those could be other endocrinal issues that they may be having, or structural issues. So accordingly we have to manage the case. So this was in brief that we mentioned about the problems and the solutions that we try to give. I think, doctor, we can explain a brief about the therapies that we were saying earlier. If you could tell them about one or two therapies that you prescribe commonly to your patients.
Thank you, doctor, for the elaborate explanation in regard to the nutrition. And you also beautifully explained about the importance of the diet, or the Agni, what all Ayurvedic practitioners stress on. So I would like to talk about a few therapies which can be done under supervision or under the guidelines given by a Ayurvedic physician, which a couple can undergo. So to name a few, they are whole body oil massage, which is called as Sarvanga Abhyanga in Ayurveda, and Yoni Pichu, or a vaginal tamponing. So what measures do we require to perform these, and why it is important? Since our skin is the biggest organ of our body, and whatever we put on the skin, it gets absorbs. And Pitta takes a major role in absorbing it and assimilating it in the tissues. So the importance of getting a whole body massage at least weekly once gives very much of, I would say, very much of benefit. Very much of benefit is being given in this.
Yeah, as doctor was explaining about Sarvanga Abhyanga, that is normal generalized oil application or self massage, because as I mentioned earlier, we are working on the Vata factor. Controlling the Vata dosh is very important, and this oil therapy extremely becomes important in that case. I have prescribed to my patients many a times treatment like abdominal pack, where they have to do a certain massage on their abdomen using castor oil or sesame oil or whichever oil that is indicated. So basically with this kind of therapies and the Yoni Pichu, which is a vaginal treatment that she was mentioning, we are trying, these are localized treatments. through which we are trying to improve the functioning, improve the blood circulation in that area, and trying to work on the tissues. Like for example, if you do abdominal pack, then your uterine blood flow improves. If there is any inflammation, pain, swelling in the pelvic area, that is reduced. If there is bloating, constipation, if there is a lack of blood flow during menstruation, these factors can be very well controlled. Then there are therapies like sitz bath using medications, wherein vaginal infections can be handled. So this kind of therapies, yoni pichu is extremely useful in having a good sexual intercourse. If you are having vaginal dryness, vaginal infections, tightening of the vagina, or flaccidity in the vaginal muscles, because of which the sexual intercourse doesn't happen properly, then vaginal douche or yoni pichu helps in lubricating the vaginal canal and having proper sexual intercourse. So there are various kinds of therapies that can be prescribed according to the case. There is a foot bath, medicated foot bath that I generally prescribe, sitz bath that I told you, yoni pichu which doctor mentioned, abdominal pack, sarvanga abhyanga, nasyam. These are the names of the therapies which we generally prescribe, and we tell them how to conduct these therapies. So I think we have given you a brief idea about what exactly our protocol consists of. We emphasize on the nutritional part of it, on the lifestyle part, like how much you have to sleep, what time you should be sleeping, certain tips to guide control stress, certain tips to improve energy levels during the day, then therapies as we mentioned, and at the end the medication. And the medication is also minimal medication. We do not give a lot of medication. With whatever medication that we give, that is sufficient if you follow diet, nutrition, lifestyle, and exercise properly. So because it is a holistic program, these things go hand in hand. One thing, if you do, like if you just continue taking the medication, it is incomplete. If you only follow the diet without medication, without following exercise, it is incomplete. If you only stress on doing exercise without doing other things, with this individualistic approaches, the process may take a little longer. But when you hammer on all the sides and start everything simultaneously, holistically, then we will be able to give better results and faster results. So this is in brief about the Ayurveda and nutrition program at Fertility Dost. If any of y'all have any doubts to ask, any queries, then please let us know.
One more thing, I think most of the members who are attending our session are from our premium members, and the ladies who are from who are not enrolled in any of our programs, there are few members also right now. So could you please give your पर्सनल फोन नंबर इन द चैट बॉक्स सो दैट अगर आपको डॉक्टर्स के साथ वन ऑन वन कंसल्टेशन चाहिए तो वी कैन अरेंज फॉर दैट. And if you have any queries, please you can switch on your cameras and unmute yourself and ask.
I think we got one question. Can tubes be opened through the diet? So to answer this question, we need to know many more things, like what has happened that the tube is blocked, whether the water is filled, whether there is any infection, or whether it is because of any adhesions. So only through the diet, I would say it is very much difficult to clear the tubes. Of course, with the medicines and the change in the lifestyle, we can help in improving the function of the tube. So for a tube to be patent, we have to work from the line of your diet, from your line of your medicines, and a changes in the lifestyle. If these 3 points, if we check it, we can help in achieving that. But only through the diet, if you ask, it is very difficult to get the tubes working. Does lemon affect male infertility? So anything which is taken in moderation gives benefit. If we take excess of what amrita, it is also a poison, right? So anything which is taken in moderation is good. Anything which is taken as per your diet, as per the place, is good. So alone lemon may not directly hamper the male fertility factors.
Ma'am, one question to ask.
Yes, please.
I have PCOD problem, so how can I treat that? I have PCOD problem since I was 14 years old. Now I am 34, but still it is going on, and that is the major reason. I have conceived 2 times by IVF, and there was one failure of IVF cycle.
Okay.
But yeah, so PCOD was the major reason that I conceived and then miscarried at the time of 1.5 months.
Right. So basically, PCOD, I think you will be very much aware as of now that it is a lifestyle disease, and PCOD has also a genetic predispositions as well. If a family member is suffering from PCOD, then there are high chances that the next generation in that house can suffer from PCOD. And again, it also affects the metabolism. So along with the PCOD, it is very much common to have a thyroid dysfunction as well. So thyroid dysfunction, and you're more prone to have diabetes. So why there was a miscarriage, that would be basically or directly we can imply on the eggs, because in PCOD you have very numerous immature eggs in the ovary, which are being stimulated with the external hormones, which they are ruptured and the embryo is formed. So maybe somewhere the quality of egg itself is a matter which has caused for an abortion to happen. So how you can improve is the question. So there, yes, we should understand about your lifestyle, basically about what you eat and how you eat. Though we say these are the certain food items to be consumed. So what suits you? There is no hard and fast rule, right? That what rice one person A eats will also suit to the person B. So as per the place and as per your metabolic needs, we can customize a diet plan and medicines which will certainly give you result. If we work on your basic body metabolism, in the sense if you are working on correcting the HPO axis, that is a brain ovarian axis, pituitary and ovarian axis, we can improve the quality of the egg. And if you're suffering only with PCOD and there is no other anatomical factors, like the husband factors are very good and the tubes are patent, that means there are very high chances that you can conceive naturally as well, along with the medicines. Of course, along with our Ayurvedic medicine and diet, we have seen
have
the
had
result. Yeah.
many cases of PCOS we have handled at Fertility Dost, and that is one of the major cause of infertility that we have handled. So yes, again, as doctor is mentioning, we'll be able to tackle better if we understand the case history properly,
Right.
and give you a customized plan accordingly. But this is solvable. We have to work on all the parameters and the ovarian and the this thing, quality of the eggs also.
But I took the donor eggs also,
Okay,
but that was again a failure.
okay, okay. In that
Actually,
case,
I
yes,
conceived. Yeah, I conceived, but I miscarried at the month of 1.5 months.
with the donors also, right?
Yeah.
Then the endometrial or the uterine factor needs to be evaluated. Like,
Actually, my tubes are blocked. My both tubes are blocked.
okay.
So,
See, if your tubes are blocked, then the endometrial, factor needs to be evaluated, whether it is healthy enough to for the implantation and for the continuation of a healthy pregnancy or not. Then we will have to work on that.
Simpler terms, what we would say is the overall hormonal status should be addressed. Metabolic issue means we have to improve your metabolism. That is what it is. A donor egg or the
Yeah.
own egg also, your metabolism should be improved. That is the utmost prerequisite, we could say. Otherwise, how we can achieve nourishment to the embryo, right? That is also utmost important. So you should consider working on all these factors, which will give you result. Yeah.
Ruchi, I would suggest that at least for 3 months, try preparing your uterus. Because हमने बहुत cases देखे हैं donor egg या donor embryo या we can say that donor cycles बहुत rare होता है, fail होते हैं. ठीक है, डोनर यूजली हम लेते ही इसलिए हैं कि उनका सक्सेस रेट थोड़ा ज्यादा हो, और अगर डोनर फेल हुआ है देन आई वुड सजेस्ट कि तुम्हारे जो अंडरलाइन कंडीशंस हैं वो तुम्हारे यूट्रस के साथ हैं, नॉट विद योर ओवरीज और गैमीट पार्ट. ठीक है, तो पहले हम उसको रेक्टिफाई करने की कोशिश करेंगे. एंड एज डॉक्टर स्वाति एंड डॉक्टर सुजल सजेस्टेड, अगर तुमको लगता है तुमको कंसल्टेशन लेनी है तो जस्ट शेयर योर रिपोर्ट्स एंड आई विल अरेंज फॉर दैट.
Sure, ma'am.
ऐसा कुछ भी नहीं है जो इम्पॉसिबल नहीं है, वी कैन डू दैट. हाँ, थोड़ा मेहनत और थोड़ा एक चीज को लग के करने की बात है, दैट्स इट.
In some cases, it might take time. Hard and fast, we can't tell that 1 month, 2 months, 3 months, although we have received results in lesser than 3 months also. But this is one such thing that you cannot be actually seeing the changes that are happening in the body once we start with the protocol. You can't see anything changing. It is at a very subtle level. But sometimes it may take time. Sometimes you might see the results right in the second or the third month also.
I would like to take this question. Which type of diet plan and lifestyle can cure endometriosis? So endometriosis is a condition in terms of Ayurveda, if you're understanding. Endometriosis is mainly because of Vata dosha or the increased Vata dosha, I would say. So the diet plan and lifestyle should be mainly focusing on pacifying that, the Vata dosha, and how this increases is by your faulty eating habits, consuming more of raw food, as already Dr. Sujal has given an elaborate explanation in regard to that. Raw food, stale food, or very much of dry food, spicy food, irregular eating habits, too much of caffeine, too much of raw juices in the diet. All these factors are going to increase the Vata dosha. And the very best and the easy method to pacify is the one, I would say, your whole body massage, which I was just talking about, and my son just barged in that time. So I would like to add a few points in regard to that. So in what we do in a whole body massage, or why it holds important, is applying oil all over the body, or the lukewarm oil. Which oil, if you ask, I would suggest sesame oil is the best one in regard to the fertility, and considered as a utmost top oil in regard to the massages. Just apply a lukewarm oil all over the body in the direction of hair follicles, and after 5 minutes take a hot shower. This is going to pacify Vata dosha also, and in turn giving you all the benefits of the sesame seed, which is said as the utmost fertilizer or fertilizing agent, or the fertilizing power drug what is available as of now. So complete body should be applied with the oil, followed by a hot water bath. In case if you don't have time, I would suggest of having oil massage at least on your abdomen and the lower limbs. In case if you had gone for a very long travel, if you had to travel for certain distance in that day, in a single day, that will also increase Vata dosha, and during that period of time also undergoing oil massage is said to give wonderful results. And when to avoid oil massage is at the time of your menstruation or until you're bleeding. You should not indulge yourself in an oil massage, and bathing as such should not be done immediate after a food consumption. immediate after food consumption, you should not have your bath. So in these 2 points, we can consider is that it is completely contraindicated, and in all other methods can be implemented for to have a oil massage followed by a warm water bath.
I think, thanks, doctor. I
Yeah,
think there is a question on how to improve the diet and lifestyle for improving egg quality, right?
right. Yeah.
Okay. So now, so yeah, when we are targeting egg quality particularly, as we mentioned earlier, there are two things in this. One is we have to do the systemic evaluation of that patient. As we have been saying, we have to look at the digestive factor becomes very important. So if their digestion is faulty, then whatever super rich foods that we will prescribe for them, it is going to be of no use. See, remember, if the road is clear, road here in terms of what I mean is the micro channels which are going to carry the nutrition to the egg. Your egg is the last part on the road. It is the last destination. So it has to first travel a very big roadway to reach to the destination. If there are blockades in that roadway at multiple places, if your road is having hindrances at multiple places, then the nutrition factor will not reach to your egg. Even it may be the truck may be loaded with the best of fruits and vegetables, but it will not reach its destination if there are blockages in the micro channels. So we have to work on improving the road quality. We have to work on improving the digestive function, which is not only located in your stomach, but it is located throughout the body in the micro channels till your endocrinal and reproductive system at the cellular level. So we have to start working from that factor first. Once we see that your channels have opened up after detoxification, after improving the metabolism, after improving your digestion, then we can give you certain foods which will improve the quality of maybe your egg, maybe your endometrial thickness or endometrial quality, or your uterine functions, whatever that we are targeting. Now, which are the foods that improve the egg quality? As I mentioned earlier, certain dairy products like cow milk, cow ghee, which is prepared through the traditional method. There are few seeds like pumpkin seeds, sesame seeds, flax seeds, then even eggs, organic eggs. Now, these should be procured organically. Then meat, specifically red meat, but mutton, which is procured from animals which are eating organic fodder. It should not be processed or chemically procured meat. Then fruits and vegetables, which are again not chemically grown or not, or they are not genetically deranged. This kind of produce which is organic, whole grains, fruits and vegetables, they may be eaten. I have given you a few examples earlier, like pumpkin, broccoli is there, then beans are there, mung beans are very good. In fruits there are pomegranate is there, amla is there, these are known as rasayan foods. Then various spices like fenugreek is there, cumin is there, carom is there. So they need to be prescribed according to the state and stage of the disease. But these are in general certain foods. Then certain recipes which are known to be very good in promoting fertility are various types of milk preparations. हम उसको porridge खीर बोलते हैं. They are supposed to be good. Certain kinds of fruit preparations like kharjur panakam is there, Kharjurati mantham is there. These are traditional recipes that we sometimes prescribe to the patient. So there are then laddus are there, sesame seed and ghee laddu is there, or Rajgira laddu is there, or certain preparations including it's a permutation and combination of so many things. So we can't be giving you that big list over here. We have to decide according to the patient. Yeah, thank you.
So, does raw salad consumption also impact fertility? This is the question we have here. So, raw salad as such directly will not impact the fertility. So, the issue with the raw salad is that it needs a very good digestion to digest the salad. So, having raw salad may cause more of gassy formation and it takes time, a lot of time for the salad to get digested. So easy solution for this is just steam cook the vegetables which you use in the salad, and then you can consume them. And raw salad consumption is ideal at the intermediate time, that would be at 11 a.m. and not just before consumption of your meals. So Ayurvedic principles say that on stress that the first bite of your food, what you consume at your meal time, should be a sweet. It should not be raw salad. Yeah. So yes, raw salad decreases the appetite, but we want the appetite to be in the highest level. We want the fire to be burning. Illumination is required. We don't want it to stop it completely. So the raw salad will not do good. It is okay to have steam cooked salad, and if your digestion is at the top level, then you can have raw salad. Otherwise, it is better to switch on to having steam cooked salad.
Thank you, Dr. Swati. Thank you, Dr. Sujal. We are now going to wrap up the session. Viewers who are in this session, अगर आप में से किसी को भी अलग से consultation चाहिए तो please you can message me directly, or you can message on our official number, or you can share your phone number on the chat box. We will connect you. एंड हमारे 2 और सेशंस हैं सैटरडे एंड संडे को, प्लीज उसको मिस मत कीजिएगा. टुमारो वी हैव 7 AM कपल योगा एंड कपल मेडिटेशन. इसको तो जरूर अटेंड कीजिएगा विद योर पार्टनर. आई थिंक आज थोड़ा सबके लिए मुश्किल था बिकॉज इट्स अ वर्किंग डे, बट श्योर कल हम आपसे फिर मिलेंगे. एंड ऑन संडे डोंट फॉरगेट टू लॉग on Sunday at 12 noon. Very interesting session, couple counseling, and उसमें कुछ interesting activities हैं जिससे कि आपको हो सकता है गिफ्ट भी मिल जाए. So please attend these 2 sessions in coming 2 days, because this is our Valentine special weekend. We are celebrating with you all. हम चाहते हैं कि आपकी पेरेंटहुड जर्नी बहुत बढ़िया बने, प्यार से भरपूर, एकदम मस्त मजेदार. सो प्लीज डू कनेक्ट विद अस. एंड अगर आप में से किसी को कुछ भी कंसर्न्स है, कुछ भी है, एंड यू थिंक दैट यस यू नीड टू कंसल्ट आवर डॉक्टर्स, हम लोग आपकी जर्नी में किसी भी तरीके से हेल्प कर सकते हैं, तो प्लीज ड्रॉप अस अ मैसेज ऑन आवर ऑफिशियल नंबर. और जिन लोगों के पास मेरा पर्सनल नंबर है, दे कैन कनेक्ट पर्सनली विद मी ऑल्सो. So thank you everyone. Thank you for joining. Thank you doctors. Thank you. Bye bye.
Thank you.
Thank you. Thank you.
Thank you.